Hello, my name is Sania Waheed. I am a second-year pharmacy student, and today I will be presenting about acute decompensated heart failure. Today I will be covering what is acute decompensated heart failure, pathophysiology, precipitating factors, signs and symptoms, clinical treatment, monitoring parameters, summary, and my references. What is acute decompensated heart failure? Heart failure is a complex clinical syndrome that results from any structural or functional impairment of ventricular filling or ejection of blood. Acute decompensated heart failure is defined as a clinical syndrome in which a structural or functional change in the heart leads to its inability to eject and or accommodate blood within physiological pressure levels, thus causing a functional limitation and requiring immediate therapeutic intervention. Acute decompensated heart failure is new or worsening signs or symptoms of heart failure which require medical intervention such as an emergency department visit or hospitalization. Next, I will be talking about the pathophysiology of acute decompensated heart failure. In 75% of cases, acute decompensation occurs in a patient with known chronic heart failure, and 25% have new onset heart failure. A diverse process ranging from well-appearing patients with mild pulmonary edema to cardiogenic shock. Acute pulmonary edema is caused by overactivation of the sympathetic system by an acutely decompensated heart. Worsening decompensation causes left ventricular function to decrease, while sympathetic tone increases, causing patients to present in progressive stages of extremis characterized by severe hypoxemia and hypertension. Some of the precipitating factors of the decompensated heart failure are non-adherence to your medication, arrhythmias, myocardial ischemia, pulmonary embolism, uncontrolled hypertension, infection, excessive alcohol or illicit drug use, negative ionotropic drugs, increased salt retention. Prognosis. There are 4 hemodynamic subsets that provides a useful framework. Recognition of volume overload, pump failure, and shock are important aspect of the management of patients with ADHF, acute decompensated heart failure. There are 4 subsets that are useful when identifying the progression of patients' condition depending on the signs and symptoms they're having. The 4 subsets are subset 1, which is warm and dry, subset 2, warm and wet, subset 3, cold and dry, and subset 4, which is cold and wet. Next, I will be talking about the signs and symptoms of acute decompensated heart failure. The signs and symptoms of acute decompensated heart failure are classified into wet and cold. Wet symptoms, which are due to fluid overload or congestion, include weight gain, dyspnea on exertion or at rest, orthopnea, tachypnea, and oxygen saturation less than 90%, crackles and rales, jugular venous distension, and peripheral edema. Cold symptoms, which are due to low cardiac output or hypoperfusion, include low cardiac output, extreme fatigue, hypotension, narrow pulse pressure, cool extremities, organ hypoperfusion, worsening renal or hepatic function, and altered mental status. Goals of therapy. Goals of therapy during hospitalization is to provide, first and foremost, symptomatic relief, optimize volume status, and optimize cardiac output. Goals of therapy before discharge are to optimize chronic oral therapy, provide patient education, and prevent future hospitalizations. It is also important for patients to maintain guideline-directed management and therapy. In most patients with reduced ejection fraction, heart failure with reduced ejection fraction, chronic oral heart failure therapy should be continued or even up-titrated during hospitalizations and continued post-hospitalization and after discharge. Next, I will be talking about the treatment available for acute decompensated heart failure. For volume overload treatment, usually loop diuretics are first option, then thiazide diuretics and vasodilators are also used in patients that have certain conditions. Frequently used loop diuretics are furosemide Lasix, torsemide Demodex, and bumetanide Bumex. Thiazide diuretics are usually used for patients that have diuretic resistance or refractory to loop diuretics. Some of the thiazide diuretics that are commonly used are metolazone, hydrochlorothiazide, and chlorothiazide. Vasodilators are for select patients who have refractory volume overload, and those include nitroglycerin, sodium nitroprusside. For low cardiac output, vasodilators are used, inotropes are used, and temporary mechanical circulatory support is given to patients. For inotropes, those are used for select patients with refractory acute decompensated heart failure. The two common inotropes that are used are dobutamine and milrinone. And temporary mechanical circulatory support is given to patients with certain conditions and signs and symptoms of low cardiac output. Monitoring parameters. Some of the important monitoring parameters that are monitored while the patient is in hospital and also should be monitored while the patient is at home include vital signs like blood pressure and heart rate, cardiac rhythm, weight, fluid balance, electrolytes, renal function, signs and symptoms of congestion or low cardiac output, and hepatic function. Summary. In summary, acute decompensated heart failure is a sudden worsening of the signs and symptoms of heart failure, which include difficulty breathing, leg or feet swelling, and fatigue. Acute decompensated heart failure is also a serious cause of respiratory distress. Immediate goal is to reestablish adequate perfusion and oxygen delivery to end organs. It is important for patients to have stable guideline maintenance therapy and optimization of chronic heart failure medications. Patients should adhere to medications and healthy diet habits to prevent future hospitalizations and problems with heart failure. Daily body weight monitoring is one of the most important monitoring parameters for patients with acute decompensated heart failure, and patients should be referred to disease management program for better outcomes of their treatment. These are some of the references I used in my PowerPoint presentation, and thank you so much for listening. You have a wonderful day.